Hi, I'm Karl Steinberg, and I have the honor of chairing the Society's Public Policy Committee over the last several years. I'm also editor-in-chief of Caring for the Ages, which is one of my favorite things to read. And it's nice to be here communing with my brethren at the Society's annual meeting here in Dallas. So I think among the biggest priorities and the biggest things going on in the policy arena for our membership probably have to do with payment reform, MACRA, MIPS, alternative payment methods, and all these, or alternative payment models. See, my own alphabet soup is slightly off kilter, but that really impacts the way we practice. It also impacts the way skilled nursing facilities are going to be paid. We've got new payment methods coming up for them as well. The rugs are going away, and so there is a lot of change in the air. And I think as we shift to more of a value-based sort of system, we have to rethink the way we do things. And I believe that it's going to turn out to be positive in the long run. Other sort of trends that we're following have to do with, the perennial sort of tort reform type issues. And there's been talk about designating our work as a specialty in the way that hospitalists also did. And I think that might be a good idea, because essentially we're being compared to outpatient primary care doctors who have a completely different population from what we take care of. And under the current MIPS evaluation system or point counting system, we're going to take a huge beating on the costs of care for our patients. So if we really want to be compared sort of apples to apples, I think specialty designation would be great. I think our society, we've really had to adapt. We've had to become a lot more nimble as an organization, a lot more innovative. And we've got some young, bright, rising stars that are helping us to do that. But I think because of the sheer level of change, it's like, we're on this crazy train. We don't know exactly what direction it's going in, but we have to be ready to adapt to it. So I think the work we're doing in the policy arena, in the quality measures arena, and as far as just clinical practice, advanced care planning, all those types of things, we have a seat at the table. We're there with CMS. We have frequent communication with them. And I'd like to strengthen our bonds with other organizations, American Healthcare Association, Leading Age, the Consultant Pharmacist Association, NADANA, GAPNA, all those organizations, because I think when we work toward our common goals together, we are much more powerful. As far as how we can impact things, I believe it's, again, collectively, I think we can do the most. So find common ground with the industry, the nursing home industry, which is in a big state of change right now also, and other stakeholders that are in the same arena. Find common ground and try to work from within and really try to get on top of things before, let's say, before a final rule gets published. And we've had some success with these things. We have issued comments, and many thanks to our membership and our leaders for going through so many pages of Federal Register and so on to come up with really valuable comments. And CMS doesn't necessarily take everything we say and implement it, but they are listening, and they certainly have implemented some things. And we've had some significant successes in the policy and in the payment arena over these last several years, and I hope that'll be a continuing trend as we go through this period of really rapid change, kind of unprecedentedly rapid change in our industry.